this presentation, I'll be discussing the role of physiotherapy in a conservative management of first-time anterior shoulder dislocations. Shoulder dislocations are the most common dislocations seen in emergency rooms. They account for between 8 and 17 out of every 100,000 patients. Anterior shoulder dislocations account for 95% of all shoulder dislocations, with 85 to 92% of these going on to redislocate in the future, especially in younger populations. The most common mechanism of injury for anterior shoulder dislocation is from contact to the back and or side of the shoulder when it is in an abducted and externally rotated position, as seen in Figure 2. After you've had an anterior shoulder dislocation, it is very important that you see a physiotherapist to reduce the risk of redislocation or recurrent instability. Your physiotherapist will use a graded exercise program to help optimize healing, regain normal function, and get you back to sport or normal activities as fast as possible. To do this, they will use a rehabilitation protocol similar to the one proposed by Wilkes and Raynauld, which utilizes 4 phases, with each phase tailored to the stage of healing you are in. Phase 1, the acute phase. During this phase, the main goals are to protect healing structures, decrease pain, inflammation, and muscle guarding, slow muscle atrophy and re-establish voluntary muscle control, begin to regain pain-free motion, regain dynamic stability, and improve proprioception. Proprioception is our ability to know where our body parts are in relation to each other. The acute phase will start with immobilization in either a sling or brace for 1 to 4 weeks. The length of time in the brace is mostly based on age, with younger patients requiring less time in the sling. During immobilization, it is important that you continue to move your elbows, wrists, fingers, and shoulder blades to ensure that they don't become stiff. Once the initial immobilization period is over, you will begin to perform some gentle passive range of motion exercises, such as the pendulum arm swing as seen above. These exercises allow the joint to begin to move without stressing the healing muscles. You will also start pain-free static contractions of the muscles around your shoulder. This will include the muscles used for shoulder flexion and abduction, as well as internal and external rotation. You will also begin some exercises to regain the stability of the joint. This will include strengthening of the muscles that move your scapula, as well as your physiotherapist moving your arm through pain-free range of motion while you keep your shoulder blade set in one position. Once you have regained nearly full passive range of motion in your shoulder, have no or very little pain or tenderness during movement, and have returned to baseline levels for proprioception and dynamic stability, your physiotherapist will progress you to Phase 2. Phase 2 will focus on continuing to improve your range of motion, stability, and proprioception, as well as regaining normal joint movement and neuromuscular control. To do this, you will begin strength exercises within a pain-free range of motion, active assisted range of motion exercises, where you will use your good hand to assist movement of your affected shoulder. You will also begin closed kinetic chain exercises to improve stability. Closed kinetic chain exercises consist of exercises where your hand is planted against an object, such as the wall, while you perform the exercises. This will lessen the stress on your shoulder. Phase 3 is the advanced strengthening phase. To advance to this stage, you'll need to have full pain-free active range of motion, no pain or tenderness during movement or palpation, and near or normal strength in the muscles of your shoulder. Goals of this phase are to continue to increase strength, stability, and control in your shoulder movements, especially in end-of-range positions. It will also focus on improving the endurance of your muscles, as fatigue has been shown to reduce control. Phase 3 also starts to prepare you for return to sport or normal activities. This phase will begin to include advanced strength training, including bench press, seated rows, and lat pull-downs. This will be completed within a restricted range of motion, especially in external rotation. Endurance exercises will consist of 30 to 60 second bouts of shoulder movement exercises performed several times a day. We will also begin two-handed plyometric exercises such as chest passes and overhead soccer throws. In order to begin Phase 4, your physio will perform a full clinical exam of your shoulder, including active and passive range of motion, as well as strength and stability of your shoulder. You'll need to pass this exam before you can progress. You'll also need to have no pain during movement or on palpation of your shoulder. The goals of Phase 4 are to maintain the strength, control, and stability of your shoulder joint and to prepare you for return to sport or pre-injury activity. During this phase, you will continue with your Phase 3 exercises. You will now be able to return to a full gym program that has been approved by your doctor. To get you ready to return to sport, your physiotherapist will assist you to set up a sport-specific graduated interval program. If you are returning to a contact sport, it is recommended that you wear a supportive shoulder brace initially for extra protection. This whole process can take anywhere between 4 and 24 weeks, depending on your age and the severity of your injury. Thank you for listening, and please feel free to give Griffith Health Clinics a call and book an appointment with one of our staff or students today.